I'm Dr. Karthika, gynecologist from Vardhan Fertility Centre. Today let's discuss about travel during pregnancy. I hope all of you having a lot of doubts like when to travel during pregnancy, what is the safe time and what are the precautions to be taken. So let's answer for all these questions. First question, is it okay to travel during pregnancy? It depends on the mother and baby status. First, you have to consult a gynecologist. You have to get a one checkup done about your health status like BP, pulse, sugar, and regarding the baby status, how is the growth of the baby, how much is the fluid level, what is the heartbeat of the baby, what is the position of the placenta, is everything safe or not. Once it's cleared that yours and baby status are fine, you're okay to travel. Second thing, what is the safest time to travel is usually from 4th month to 7th month. It is considered safe for travel. Why in first 3 months travel is avoided is because many patients will be having severe vomiting, tiredness, and morning sickness. And if you travel for long distance, it will aggravate your nausea and vomiting. Otherwise, if you don't have any symptoms like vomiting or morning sickness, it is okay to travel during first 3 months also. But in special considerations like IVF pregnancies, we generally recommend rest during first 3 months, not to travel excessively. Then what is the preferred mode of travel during pregnancy? There are different modes of travel like airplanes, car and train. If the duration of travel is longer and if you're planning from city to city, then to cut short the duration, you can go for airplane travel. It is safe till 9th month of pregnancy. And if you don't have a airplane facility, you can prefer a train instead. Train is the best and safe travel method. Why? Because vibrations will be less and you can move around and you can stretch yourself and you can use the washrooms at times. So it is considered safe during pregnancy. The only disadvantage is that in case of emergency like pain or bleeding, anything, you can't get down. So you have to travel according to the month of pregnancy. If it is close to 9th month and all, better avoid train travel. Next is car travel. If it is shorter duration like 2 to 3 hours, you can prefer car. While you prefer car travel, you have to take some necessary precautions before planning your travel. You have to wear loose fitting cotton cloths and pack adequate fruits and vegetables or some snacks to eat in between. And you have to hydrate yourself, carry plenty of water with you, and you have to wear seat belt mandatorily, and you have to take break in between. You have to stop the car and move around and walk around, stretch yourself, use washrooms. And always, it is very very important, always carry your medical records, all the medications what you're taking, because in case of emergencies you might need to seek a different healthcare facility help also. So you need all the medical records to carry with you. While planning your travel, better avoid high altitude travel unnecessarily. And also don't plan your travel to areas or regions where there is disease outbreak like malaria, dengue, or any infectious disease outbreak. Better avoid your trip to those areas.